Secretary of State Antony Blinken calling for a deeper probe into the origin of COVID-19. Is it too little, too late? Reaction now from Iowa Republican Congresswoman Mariannette Miller-Meeks. She's also a medical doctor, lieutenant colonel in the Army. So much. I run out of space describing everything you are or have done, Congresswoman. I'll call you doctor. I am worried about WHO again being part of the discussion here after everything that they are complicit in with regard to helping China cover up. I don't think it's going too far to say they helped China cover up the extent of this problem of the pandemic. Do you?
Well, certainly the WHO is compromised, and that's why we need to have U.S. researchers, U.S. scientists to be able to go into China, to the Wuhan Institute of Virology, and look at the books, look at laboratories, and look at processes within the Wuhan Institute of Virology, which is probably where this virus emanated.
But Congresswoman, they're not going to just open the books. They're not going to do it on the basis of talk, no matter how much of a love fest President Biden is having over in Europe right now. Nice talk, happy talk is not going to get them to open the books. You have to use some kind of stick. I'm suggesting, by the way, saying if they don't do it, they lose their seat in the Security Council at the UN. You need something like that to force their hand, don't you?
I think you're exactly correct. I mean, the president right now is in a very desirable position at the G7 summit with other nations that they all together combined could have this force that China needs to be held accountable. They've denied this. No one's looked into the origins. Even when Senator Cotton brought this up, he was in essence dismissed that it could have been a lab leak. No one's saying that it's intentional, but we need to know from a public health standpoint, a national security standpoint, right. And then we also need to know from the media looking themselves into the mirror and say, we shouldn't be so quick to dismiss something just because we don't like the source of that information.
Well, we do know it was
right.
intentional to the extent that they allowed people from Wuhan to go to the United States, Europe, spread the virus, even though they were preventing people from Wuhan to going to other parts of China. So they knew something was up. I want to switch quickly to a federal ruling on vaccine mandates. A Houston judge dismissed a lawsuit by hospital employees who were suspended because they refused COVID-19 vaccines. Where do you stand on this?
Well, I don't think that we should have a federal mandate for the COVID-19 vaccines. But interestingly enough, working in the hospitals in which I was a staff member, hospitals required us to get vaccinated for influenza. Now, you could appeal that decision, or you could ask for a waiver if you had a medical reason that you could not be vaccinated, if you had an allergy, or if you had previous, and I think in this case, if you can show that you've had previous infection with COVID-19, you ought to be able to use that for an employer.
Good.
So I think no vaccine mandate by the federal government, but I certainly understand businesses wanting to protect all of their employees and their customers, and so they may ask for an individual to provide a waiver.
Very quick answer. Are you still paying a fine for not wearing a mask in Congress?
Well, I'm not sure yet. But if I have to pay it, I'll pay it. It was worthwhile doing it to get Nancy Pelosi to listen to a small voice that said we should not have to wear a mask if we've been vaccinated.
Congresswoman, Doctor, great to see you. Thank you for coming in again. Appreciate it.